Hello, this is a short video on cervical cancer awareness. Cervical cancer or cancer of the mouth of the uterus is one of the commonest amongst Indian women, second only to breast cancer. Now the good news is that this cancer has the best possibility for early detection and treatment. But the bad news is that awareness amongst our women is very poor and therefore they do not utilize available options for cancer prevention. So let's learn a little about screening and prevention of cervical cancer. First, what are the risk factors? What lifestyle habits puts a woman at higher risk for cervical cancer? Early age at onset of sexual activity, multiple sexual partners, poor personal hygiene, multiple childbirths, infection with HPV, which is human papilloma virus, which is a very common form of sexually acquired disease, and smoking, tobacco. Second, did you know that cervical cancer prevention vaccine was available? Just like polio and smallpox were eliminated from the face of this earth, some forms of cervical cancer can be prevented by the vaccination. So 3 doses of the vaccine for all females 9 to 43 years of age is recommended. Please talk to your doctor. Third, plan regular screening with a simple test called pap smear. It costs about 200 to 300 rupees and takes about 5 minutes. Most gynec and pathology clinics do it. Start screening from the age of 21 or after becoming sexually active. Pap smears are recommended every 3 years up to the age of 30 years. Between the age of 30 to 65, a pap smear and HPV screening should be done every 3 to 5 years. Don't worry about the white gap. This is a slow growing disease. After the age of 65, generally screening for cervical cancer is not required. Finally, recognize the warning signs, some of which are abnormal and foul vaginal discharge, abnormal vaginal bleeding, bleeding in between menses, bleeding after intercourse, and bleeding after attaining menopause. So in summary, best tips for young girls to prevent cervical cancer: quit smoking, delay sexual activity, avoid multiple partners, insist on using condoms, and get vaccinated. I hope this was useful. Thank you for watching.